Hello and welcome to today's episode of Health Youniversity, where I have the pleasure today of including in our conversation Dr. Toni Engram. And Dr. Toni, do you prefer Dr. Toni or Dr. Engram?
Either one works. We can do Dr. Toni.
Okay, so Dr. Toni is a biological dentist, and I know I'm going to butcher this, so I'm going to invite you to correct whatever description I give it. But the importance of this conversation is the link between our oral health and our fertility and our pregnancy. So I'm really excited to have Dr. Toni in on this conversation and giving tidbits and probably some words of caution so that we know what to look for in our oral health and how it might be relating to our fertility. Dr. Toni, please, if you would give your own bio, because there are so many credentials here that I know I will trip over my tongue. And but I want to make sure that the listening audience hears all of what you have to offer.
Oh, you're so sweet. The credentials, yes, I'm a part of two organizations that have unfortunately long names, but I'm accredited and SMART certified through the IAOMT, and that's one of the large organizations that trains biological dentists, and it just stands for the International Academy of Oral Medicine and Toxicology. And then I'm also a member of the IABDM, so the International Academy of Biological Dentistry and Medicine. Two really great groups that I'm so proud to be a part of and have lots of good friends and sweet colleagues and lots of like-minded folks for sure.
Beautiful, beautiful. We've got some questions that we discussed prior or rose prior, but tell us, if you will, what is a biological dentist and why do we care about a biological dentist versus, Dr. DDS down the street?
Yeah, that's a great question. And it's one that I get very frequently. So there's a lot that's the same about the what we do. So yes, as a biological dentist, I still do fillings and crowns and dentures and all the normal dental things. We still do restorative work. But a lot of times the how we do it is very different. So we stand by very, very strong values that there are certain materials and chemicals that are used in dentistry traditionally that have potential toxic effects. Mm-hmm. And we're very careful with how we use them, if we use them, and how we dispose of them. So the things that you're most likely to see are fluoride-free practices. So I don't have any fluoride in my office at all. And then when we're handling those old silver fillings that so many of us got when we were kids, we handle those very carefully. I mean, there are very few dentists who still place them. So that's good. I think that's a step in the right direction. They are 50% mercury, but we handle them very, very in a very specific way. And that's that SMART certification that I mentioned in the beginning. It just stands for Safe Mercury Amalgam Removal Technique. Mm-hmm. And that means that anytime we remove an amalgam filling, we actually will stir up some mercury. Mm-hmm. And we don't want ourselves, our team members, our patients exposed to that mercury when we start drilling it out. Mm-hmm. And so we have certain protections in place to make sure that that's done properly. There are lots of other things that a biological dentist may or may not do, but I think really the main issue is that we just uphold certain values. We really believe that dentistry should be safe, mm-hmm. and so we choose our materials very carefully and very intentionally. We have a strong belief that prevention should come first. And so I know a lot of us are very, very interested and passionate about a nutritious diet and making sure that our gut health is in good shape, that our nutrition is dialed in so that we can have healthier mouths.
Beautiful.
And then we also know that, like you mentioned before, that there is a direct correlation between oral health and overall health. You can't have one without the other. And so just appreciating that connection and making sure that nothing that's going on in my patients' mouths is going to impact what our practitioners like you are helping our patients achieve.
That's beautiful. Thank you. I'm just thinking, the tissue in our mouths is so vulnerable, if you will. It's just so accessible to the bloodstream quickly, to the digestive system next, immediately down
Yes.
the tube, so to speak. So how could it not be? And how could our oral microbiome not be related to our digestive microbiome and our vaginal microbiome and our uterine microbiome? And we're seeing now a lot of infertility challenge. It is an inflammatory response in the uterine microbiome. So
That's so
let's dive
fascinating.
in, shall we?
Yes, yes.
What would you say might be the link between someone's, noticing, oh, when I brush and my floss or I floss, my gums are bleeding, and what might you say, you might want to look into how this is affecting your whole health and your fertile health?
So the correlation is direct. There's the Western medicine correlation, which I learned about first. And I'm assuming that's where you want to go with this. So we'll go.
I'll go anywhere. This is a conversation, and I think the listening viewers would go anywhere as well. They want to know the whole gamut,
Whole gamut.
Mm-hmm.
So really what I learned first, just because as a young dentist, that's just where my interest took me first, is the increasing amount of peer-reviewed evidence that is linking the inflammatory process, linking bleeding gums, periodontal disease, just a fancy word for gum disease, linking that to all areas of reproductive health. So it has an impact on fertility. It has an impact on pregnancy outcomes, on whether you can maintain a pregnancy. It impacts birth weight of an infant. So it just all of these Western medicine, these peer-reviewed evidences that a poor inflammatory response in the mouth is correlated with a poor inflammatory response elsewhere as well. But then the more I got into biological dentistry, and the more I started working with naturopaths and Eastern medicine doctors and homeopaths, the more I discovered that, goodness gracious, there's a whole other connection that I learned nothing about in school. And so I'm guessing that probably your audience has at least heard of a meridian chart, and there are these energetic connections. Mm-hmm. And in my world, we look at a tooth meridian chart. And so every tooth in the mouth is connected energetically to different organs and different parts of the body.
Fascinating. I did not know that. I was today years old to learn that there's a tooth meridian system and that each tooth is connected. So given that this conversation, of course, I'd love to know which each tooth is connected to, but which teeth might be connected to our reproductive health?
Right in the front.
Wow, interesting.
Right in the front. And we'll have to, man, if I could pull up a tooth meridian chart online, we'll go through like each one.
Perhaps there could even be a link that I could put in the show notes of that.
Absolutely.
To your tooth meridian chart that folks can look at and go, oh my goodness, that tooth, ooh, and I'm having this problem. Yikes, I can see the correlation.
Absolutely do that. And what's funny is that correlation goes both ways. So yes, there could be an infection in a tooth where you're like, when I fixed that tooth infection, my periods got more regular, or my cramping lessened, or, things like that. But I actually had one case that was so fascinating to me. Is we had a patient who's in her 50s, middle age, perimenopause, but she came in because she is a regular patient of mine. I'd seen her for years. Came in because she kept having pain in her gums around her lower front teeth. And based on what she was describing to me, it made no sense. I couldn't see anything wrong clinically. Her gums weren't even bleeding that much. Everything looked perfectly fine. Well, she came in, we did like some ozone and some laser stuff to help manage her symptoms while we tried to figure it out. She came back a couple of months later and she's like, and we were just catching up, and she was telling me about her other issues.
Her gynecological
Yes, she had been bleeding for 2 months straight, finally went in to be seen by a physician, and she had this terrible cyst on her uterus that had to be surgically removed. And wouldn't you know it, that once she got the uterine cyst taken care of, her mouth felt better and she didn't have any of those symptoms in her mouth anymore.
Fascinating.
Isn't that so bizarre?
Absolutely, absolutely. And what's also interesting to me, being a doctor of Chinese veteran acupuncture, is that this section of the mouth, the front section of the mouth, does relate to our stomach and spleen, our digestive system. How well are we assimilating our nutrients and eliminating toxicity? So there you go.
Interesting. Oh, that's so cool.
I love that. I love that when we can prove something that's always existed. That's by virtue of our medicines and our science.
Yes. And it's so funny. There are lots of now pioneers in oral systemic health and the oral systemic connection.
Brilliant.
Chinese medicine and all of these ancient practices, they've known this for forever. And we think we're so special because
the masters, they got observation, right? That's where their skill set was just supreme. They would observe, when this happens, that happens. When there's this change in the environment, be it just, change in season, something else occurs. Whereas we had then became a little bit fascinated with and enamored with our reductionist method of looking, and we forget to look at at the 30,000 feet level or the 10-foot level and see the whole body. And it's
absolutely.
Well, conversely, so this woman had a cyst on her uterus and it was showing up in her teeth. When a woman is going through, she doesn't have to be sort of in her perimenopausal phase, but she might be trying to conceive and her hormones are fluctuating. How might that show up? And how might you see a change in her oral health based upon problems in her reproductive hormonal health?
Most often it's an increase in bleeding gums, and that's very, very common. I see it almost on a daily basis. Mm-hmm. And so if there's an increase in bleeding, or even just any bleeding at all, your mouth shouldn't bleed. Mm-hmm. It's, if you scraped your hand, or if your hand started bleeding without having scraped it, we would be concerned, right? Well, your mouth should be the same way. Right. So yes, absolutely. We see bleeding gums. Then we start looking further. The most common reason people have bleeding gums is plaque tartar buildup. So that's what we're looking for first in a normal checkup. But when that doesn't line up, if we've got bleeding gums and there's like no plaque, there's nothing to clean, then we start asking questions. And one of the first questions that I'll ask is, hey, I know this is going to sound really weird, but do you know where you're at in your cycle? Are you about to start your period? Or have you been having some issues with your cycling lately? And so they'll look at me funny first, and then they'll think about it for a little bit. And so sure enough, sometimes they'll say, oh yeah, I actually am going to start my period next week. And then that makes perfect sense.
Interesting.
But yes, when things are out of balance hormonally, then we will definitely see an increase in bleeding.
My question is, I'm thinking in terms of if there are changes to the hormones that are out of balance, does that change the sort of the mineral composite of saliva that would then increase plaque production, that would then increase gum sensitivity? Or am I just taking this a little leap too far?
It's a great question. I actually don't know the complete answer to that question. I know it will definitely change the bacterial makeup. Mm-hmm. Any inflammatory markers that are in the saliva itself, it can definitely change, but it makes perfect sense that it would change mineral content, that it might change those other factors too.
Interesting. Okay, great. Yes. So there is a relationship in the reverse, that the hormonal changes will upstream, if you will, up to the mouth, show up not just as an inflammatory response, but it actually could be part of the saliva that is then having an adverse effect. And probably what I would imagine, as I think aloud, you might see things like just changes in tongue coating or breath or thirst. Do you see a correlation between, for women who are sort of having menstrual issues or fertility issues, and those kinds of things that are not specific to their teeth or gums, but are specific to their biome and
their microbiome? Yeah, absolutely. We will for sure see that difference. And you're exactly right. Changes that we would notice would be thirst, amount and quality of saliva, the amount and quality of any coating on the tongue, and things of that nature. So you're spot on. You're spot on.
So here again, Chinese medicine and biological dentistry both look at the coating of the tongue for an indicator. I love that. I also, I'm bouncing around a little bit, but toward pregnancy. Of course, everybody listening to this podcast also is, desiring to achieve pregnancy and have a healthy pregnancy. What might you advise if a woman is trying to conceive or is newly pregnant, that she look for, and forgive me, audience, I'm just going to use the pronoun she, that she look for to ensure that all is going well in her uterus?
So that's a great question. And it's one that makes me so glad every day that I work with integrative providers, because I can tell you, I used to figuratively bang my head against the wall when I was trying to speak to MDs and speak to more traditional OB-GYNs about how important it was for them to get their patients to a dentist. And I would even say, I don't care what dentist it is. It could be me. It could be my friend down the street. But absolutely get in to see a dentist to make sure the gums and the teeth are healthy as soon as possible. So if I could encourage anything, I would say, for members of your audience who are already pregnant, then yes, 100%, no matter where you are in your pregnancy, see a dentist as soon as you can. I think the sooner the better, because the sooner you go, the more we can pick up on these issues and time things if things need to be timed appropriately around baby. But if you're able to, if you're not pregnant yet, then absolutely, now's a perfect time to get these things in order and see a dentist and get a game plan first before you even conceive. I think it's so, so important. And not only does Eastern medicine support that, but Western medicine does now as well. Because 100%, if you've got some underlying gum disease, whether you notice bleeding gums, notice bleeding in the sink when you brush your teeth or not, because sometimes it's sneaky and it's not very apparent until you go in and see someone.
Right. It could be microscopic, but the inflammation is still there. And what better time to get it when it's microscopic before it becomes persistent.
Absolutely. Absolutely. And we know that can increase your likelihood of success at getting pregnant and staying pregnant, which is, I mean, what a gift that we could help patients achieve.
Absolutely. Preconception dentistry, I have never even heard of, and I admit, thought of that as an important component of preconception care. A woman will go, get a mammogram or other kind of, breast, imaging to assure that as hormones go crazy as they do during pregnancy, that there's no lesion there, that there's nothing to be, addressed before she has to wait 9 to 18 months. And so similarly, if there's something that can be identified and addressed, and really, even if there's nothing, just that assurance and that clean mouth. What better way, what better way to begin your preconception care, preconception journey than to know you're taking care of, the first area of invasion that likely occurs in a woman's body, a person's body.
Yeah, it's the entry to the rest of the gut and the body.
Exactly. Now I'm going to bounce around a little bit because I'm remembering in our conversation prior, you've got a program called the Cavity Cure, right? Yeah,
Yes.
the Cavity Cure. And so I wonder if parts of your program might be something that this audience could consider as part of their preconception care.
Absolutely.
Can you speak to that a little bit then? What is the Cavity Cure, and how someone might be able to access you and the program?
So we have a 90-day accelerator program that takes place at least partially in our office. So anyone who's able to travel to our office, that program is really kind of our top-notch, hands-on. We're going to make sure that mouth is healthy in 90 days. I also have a DIY version of just the educational content where you can get access to all the information. It is all you need to make sure that your mouth is as healthy as possible. And absolutely, it would be a fantastic resource for anyone who's trying to get pregnant to use.
Great. So we'll definitely put those links in the show notes because I would say, if people can travel, where are you? Which city?
We're just outside of Dallas.
Just outside of Dallas. So if you can travel to the Dallas area, that might be something you want to consider. If you can't, then begin with this DIY, and it might direct you to, a local biological dentist who can help you out and get you better set for healthy preconception care. Thank you for that. I appreciate it. What are some of the let me put it this way. Tell me a story about someone in the Cavity Cure program where you could say, it started this way, went through the program, and here's the happy result.
Well, what we haven't touched on yet that I would love for your listeners to really take in and let sink in is that both cavities and gum disease, both conditions that I treat all day, every day, those are both caused by bacteria that are transmissible. So in essence, cavities and bleeding gums are contagious. They're contagious. And we see that in the data over and over again. And so what I really try to stress to moms especially, because moms are the primary healthcare purchasers in the home and healthcare coordinators, basically, it's a big job to be the healthcare coordinator for the whole family.
Indeed.
Is I really want people to know that it's not just treating you. And in fact, both in my program, we very specifically say this is a family program because cavities and gum disease are family conditions.
Okay.
It is a family infection. And so we treat it as a family.
Wonderful.
So when you treat your gut, and the reason I was thinking of this is because one of our patients who's just finishing up, something that she said to me as she was finishing is she's like, when I started, I just couldn't understand why we were always getting cavities. We, meaning her and her husband and her 4 children of all different ages. And so as she was finishing, she's like, I feel like I finally know what to do to help my kids have a healthier mouth than I have.
Beautiful.
And that, break your heart story, because you can tell this mom feels so much shame she's embarrassed of her own smile. So she feels that shame, but then even more so, she feels the shame of knowing that all of her kids are struggling with this same thing. So if she can help herself, not only is she clinically, we're correcting these imbalances in the oral microbiome. We're correcting her own bacterial imbalances. So she's got more of the healthy bacteria to transmit to her kids. Because anytime you're living in the same household, you're sharing kisses, blowing on food, all of those things, you're going to transmit bacteria. But also the educational piece. So it's twofold. It's clinical and it's psychological and behavioral. It's knowing these habits that will set our kids up for success down the road.
Beautiful. And it's so funny because I was thinking that when it was like just the mom and the gestating baby. So obviously it is that because they're living in the same one body. But it's the mom and, everyone she's living with. And not even just in the home, I would imagine. But, if you're living in or working in close proximity, 8 to 10 hours a day, elsewhere, if you're in the school classroom, like there's I hadn't thought of this before, but that every step that we take toward improving our oral hygiene, our oral health, is helping. It's like an act of kindness to everyone we come in contact with. That's a beautiful realization.
And not just because of your breath.
Exactly. That's an added bonus.
Right.
People do want to get closer and kiss you a little bit more when your breath is pleasant because your mouth is healthy.
Right.
Well, this is great. I want to just make sure. Oh, yes, I wanted to touch on what tools do you have for reducing cavity risk during preconception, pregnancy, and postpartum and beyond?
So for reducing cavity risk, we use several different tools. I don't use fluoride as one of those tools. And so we've got to have other things. And thankfully, in Japan and other parts of the world, they've been using this for a long time. In the United States, we're just now catching up. And I'm so excited that we're catching up with this trend. But the use of this particle called calcium hydroxyapatite. And the way this calcium is manufactured and processed, it is ground very, very finely, and hopefully so finely that it absorbs into the tooth itself. So depending on the brand and the quality and all of that good stuff, then this type of calcium can absorb into the tooth and help remineralize where a tooth has lost minerals.
So interesting.
And then we use one of my favorite tools is to use therapeutic levels of xylitol. And xylitol is a plant-based sweetener. Again, we want to be very careful with the source of it because there are some not so clean sources of xylitol. You want to be careful that you don't ingest too much because it acts as a prebiotic and can irritate the gut. But when used orally and even nasally, it can be really beneficial at improving the microbiome.
Beautiful.
And one of my favorite studies involving moms and pregnancy and kiddos is they did a study I believe it was in Mexico that they did this study, and they gave a group of moms xylitol gum in therapeutic levels. So 5 times a day, they had these moms chew gum while they were pregnant. And then they checked again when those children were born and 5 years old.
Wow.
And when they compared the two groups, the groups of moms who chewed xylitol gum versus those who didn't, and looked at their children, the children of the xylitol group had 50% fewer cavities than the control group.
Wow.
Yes.
Wow.
That's significant.
No kidding.
Huge.
No kidding.
Huge.
So now xylitol gum, I'm a fan of it personally. But is there, in case someone maybe has some TMJ or something like that, and gum chewing isn't necessarily available to her as a therapy, what else might you have to offer?
There are lots of different products. There are candies and mints. I have a lot of parents that will buy xylitol lollipops for their kids. There's a spray it's meant to be a dry mouth spray, but I have my moms get it for their toddlers all the time, where you can just do a couple of squirts of some xylitol and get exposure to it that way. So lots of options.
The mechanism there is that it's creating more osmosis as well. So there's more water so that the plaque isn't laying down, or am I just making that up?
No, now that is a benefit to any type of gum or candy. It will stimulate saliva, which is a good thing. But even beyond that, xylitol specifically works in two main ways that help for cavities. The first way is it immediately raises the pH of the saliva. So when it comes to cavities, acid is bad. Acid is what ultimately breaks down the enamel of the tooth. And anytime we eat or drink, the pH of our mouth is going to decrease. We're going to become more acidic. And then it takes 20 to 30 minutes for us to naturally increase that pH back to normal. And if you are out of balance, or if diet is just not fabulous.
And if you're a grazer, you're never getting past that 20 minutes.
Exactly. And xylitol can make that shift happen in less than 5 minutes.
Okay. So
that's
instead of having that piece of cake for dessert, have a xylitol candy or a piece of gum, get the sweet benefit.
Absolutely.
Beautiful.
Absolutely. Beautiful. But then there's a second way that it works. And that second way that it works is the bacteria that cause cavities will ingest it because it's similar enough in structure to sugar that it fools those bacteria. So those bacteria will ingest the xylitol, but they can't metabolize it. So over time, those cavity-causing bacteria just get slippery because they don't have the fuel that they need. They slip away, and it allows the more beneficial bacteria to proliferate.
That's amazing. And am I stretching it to say that if it's proliferating in the mouth, the healthy bacteria, then it is also proliferating in the gut, and likewise then probably in the vaginal microbiome, because they're all related. It's not the same bacteria in each, but they're all related, and one is communicating with the other always.
Yes. In fact, one of my favorite brands of xylitol products, besides oral care products, they also make a nose spray. And that nose spray, when it's used regularly, has been shown to decrease the amount of ear infections in kids.
This is so cool. I'm hopeful that you may have a shop page on your website that will include into the show notes, because if you have that shop page, I presume your recommended xylitol products would be available. And that way people don't have to wonder if they're going out looking online, or in their stores, do they have the right brand or not? So we'll make sure that we have that shop page linked as well, so that we can get Dr. Toni's favorite xylitol products for oral health care.
Awesome.
Yeah. So what about, so that is for the cavities. What about for the periodontal inflammation and disease? Is there something different that you would recommend as a prevention? I mean, obviously flossing and brushing, but is there anything otherwise in lifestyle that you'd say, make sure to do this or not do that?
Diet is always going to be first. Making sure that we're eating foods that are anti-inflammatory and getting lots of nutrients, as much nutrient-dense food as we can get. And I think I've listened to enough of your content to know that you are still supporting animal products, which I do too. I feel like when it comes to tooth decay and gum disease, that having really high quality animal products is also nutrient dense food in addition to plants.
Yes. I mean, the Chinese medicine, model is we have not dropped the antiquity where we really relish the high quality of a flesh protein that has done all of the pre-consuming for us of the plants or the algae or the whatever, and then we get the benefit in those flesh tissues. But the caveat being, organic, grass-fed, grass-finished, free range, wild caught, sustainable, all those things, because that will make a difference. That's the nutrient dense that we're talking about, not the inflammatory prone.
Absolutely. And those fat soluble nutrients are so important when it comes to mouth health. When it comes to the health of our gums, we really want as much collagen as we can get. Same thing with teeth. And we want to make sure that we can absorb all of the minerals. And that's really best done with animal products. It's not that you can't do it with only plants. It's just much harder.
Right.
So that's really our first line with tooth decay and gum disease. But then beyond that, other things that are anti-inflammatory, yes, we want to make sure that hygiene is great. And we always coach our patients on the best way to do that for them and their time schedule and their manual dexterity, how well they can get in there and use floss. And so we tailor all of those things. And then we use mouthwash very carefully. So I really don't love most of the big brands that you can get in the big box store.
Yeah.
That's really it's the mouth equivalent of Roundup.
Oh,
basically.
Wow. Well, you can feel how caustic it is. I mean, you pretty much recoil because it is so strong. You can't wait to spit it out, and you're thinking, well, that must mean I've done something good for my mouth. But when I've really basically just cauterized the tissue,
yes, and killed everything, good and bad. But there are some antimicrobials that we can use for a period of time to make the shift that we need to shift to get everything back in balance. And so that is patient dependent. I use a homeopathic rinse. I think colloidal silver is very nice. Xylitol can still help over maybe a longer period of time. And then I use some oral probiotics periodically as well when we need to add some of those more beneficial bacterial strains in.
When you say oral probiotics, is this a rinse or is this something that somebody swallows, that they ingest?
Actually, a tablet. So it's not a capsule. The capsules are great for the gut because we want it to last till it gets down our digestive tract further. But if we want it to be active in the saliva, then they usually look like mints, kind of like an Altoid mint would look, but they taste better, I think. And so usually an oral probiotic will be a tablet that you let dissolve in your mouth.
Okay. All right. Very good. And I'm once again presuming that might be on the shop page. I'm going to go shopping on your site when we finish this conversation. And toward that end, I want to be respectful of your time. Thank you so much. I want to be respectful of the listeners' time, but I also want to be sure that if there's any pearl that you would want to impart that we didn't touch upon, please, the floor is yours.
Oh, goodness. I really think we summed it up in the beginning. This is such an important conversation. And whether you partner with me or someone like me, or maybe your only availability, the only option you have is to partner with a quote unquote regular dentist.
Conventional.
A conventional dentist. I really think that it's just important that you develop a relationship with a practitioner that you trust. So a lot of people avoid us. And I totally get it. But
there is no avoiding completely, right? Because then we're coming into you after the problem has presented itself, and
exactly
we're perpetuating our own problems here. Excuse me.
You're exactly right.
Yeah,
exactly right.
So I know that you had said you were a member of these academies or organizations. Would the listening audience, if they're not local to your area and can't imagine that they could get to Dallas, would they be able to look at these resources and find someone in their area or close to their area?
Absolutely. They both have directories and both have really interactive directories where you can see who's been the most active, who's done the most meetings. And so those are both really good resources.
And that's available to the public, that level. Oh, interesting. That's wonderful transparency.
Yeah.
Great. Yeah. Well, here again, listeners, my vote for you, and as I just shared, I'm going to be doing it myself, is to check out the notes, go through the links, see what you can learn and do, because really we're in charge of our health first and foremost, and then the doctor is able to support in that and we can't presume that we do nothing and have everything be exactly as we want it to. We have to engage in our own health, and truly preconception oral care is something that I confess, in all the 23 years I've been doing it, it was not forefront in my mind. If I would see something, because I look at the tongue, I would say, oh, let's get you to a dentist. But having now the understanding that this should just be a prophylactic, go get it done, get it off the checklist, much as you would your, as I said, breast exam or pap smear or anything else that you might be considering. Now's the time. So
Absolutely. I love the
your
name.
time.
I love preconception oral care.
I know, but go see if there's a URL for that.
Right.
All right. Well, I'm going to close the conversation now, and then hopefully we can pick it up later and take this up at another time. Perhaps that would be wonderful, because I think that we just touched upon a subject that we could delve far more deeply into.
Absolutely. Anytime, my dear. I'm happy to come back.
Thank you, Dr. Toni, and thank you, listeners. Until next time, be well and go have a healthy mouth and a healthy smile.